Good afternoon. Thank you for joining us for the Ask a Radiologist webinar series. Before we get started, I'm going to share some housekeeping items for today's webinar. Everyone on the call will remain muted for the duration of the webinar. At the end of the webinar, we will open the floor for live Q&A. We encourage you to ask questions, and you can submit your questions at any time using the chat box feature in the Zoom platform. If you would like to ask your question live, simply click on the Raise Your Hand button and we will unmute you during the Q&A portion. For today's webinar, we are joined by Dr. Mahanty and Stephen Downey. We also have your physician liaison, Travis Roseboro, on the phone. If you have any needs regarding patient education, referral forms, or other materials, Travis can stop by for a visit at your practice. Dr. Scott Mahanty is a board-certified radiologist with a subspecialty in musculoskeletal radiology. Dr. Mahanty completed his residency at the University of California, San Francisco, and his fellowship at New York University. He has been practicing with Charlotte Radiology for 4 years and is actively involved in the operations and recruitment committees. Dr. Mahanty's priorities include, but are not limited to, his 6-month-old Australian Shepherd, hiking the next mountain, and a well-curated sleep schedule. Stephen Downey is the manager of MRI services and is the MRI safety officer. Stephen has over 20 years of experience as an MRI technologist and has worked at Charlotte Radiology since 2010. Stephen is committed to delivering compassionate care to patients and leads Charlotte Radiology's Image of Care program to employees. In Stephen's spare time, he loves coaching sports and being a girl dad to his 3 daughters. I'll now pass it over to Stephen to kick off the presentation.
Hi, everyone. Welcome to our presentation today. We appreciate you taking a few moments of your time to sit down with us and join us as we talk about some exciting changes we have here at Charlotte Radiology, specifically with our new MRI technology. Over the years, and as the introduction said, which you were so kind for, I've been clinical MRI technologist for 20 years. And so I've seen a lot of things come and go and had a lot of patient experiences during those times. So to get us started here, this new imaging technology that we have, we're looking at changing the perception of what it means to have an MRI. And what I have come to learn over the years is that perception is reality to our patients, and what they perceive, even from the very beginning or from a bad experience they were told about, they bring that energy with them to our office and for our, to our appointments for our treatment. So MRI has typically, when you tell a patient, I'm scheduling you for an MRI, I believe most patients see that as a necessary evil or something negative to go have an MRI. It's going to be a very bad experience. It's going to be so loud. It's going to take so long. And what I've also experienced over the years is that I believe many people, once they've had an MRI and they go to tell someone about it, they want to kind of glam it up a little bit. They want to Hollywood it and make it even worse than what it actually was, which leads to a false experience that they're sharing with a family or friend or coworker or whatever. And so then that coworker comes in leaning on what their coworker has told them. And so now they're already scared of this system, and they're already worried or scared, afraid. And now they're going to fail just based on the anxiety that they're bringing in. And even if they do get through it, it's going to be terrifying for them. And in my reality, in my experience over the last 20 years, it does seem that more people have probably seen Bigfoot than have actually left out of an MRI system with a great experience. So how do we change their perception? Let's start with, again, going back and thinking about how your patient feels when you tell them they need an MRI. Are they thinking about, say, the image on the right here, where we have, 2 technologists right beside them, standing beside the scanner with headphones on in a big open space? Or are they thinking more of what is on the left here, which is basically a fancy coffin with barely a way to see into it? And what I've seen clinically, most people come in believing the MRI system is going to be a coffin. And the reality is more of what you see on the right, where you have compassionate caregivers ready to take care of them. So how do we address these needs that we see with our patients? We see our patients present here with psychological, emotional, or maybe even a physical So here at Charlotte Radiology, our technology that we've achieved and we've acquired and we're putting to use, we're going to start with our wide open bore technology. That's going to be a cylinder of the MRI, which is approximately 5.5 inches all the way around, larger than a standard MRI scanner. That means you're going to have so much more room. You're not going to be pressed from the sides. You're going to have much more room to kind of get comfortable, if you will, and kind of settle into something that doesn't feel like it's about to smash you. The second part we're going to talk about is the carrying suite design. Our carrying suite are the lights that you see around the upper part of the picture on the right, as well as our lighted wall panels. And then the ceiling image, which gives the feel or the presentation that you're actually looking outside, because we all know that just being able to see something other than the inside of a healthcare facility's walls can go a long way psychologically. The big thing we're really proud of here that is our new Recon deep learning software. And this really is going to be our game changer for our patients. It comes with improved image quality for better specificity, better MR image. You're going to get better information from this image. And at the same exact time, your patient is going to experience a nearly 50% reduction in scan time. So that's less time in the bore, less time on the table, less time to deal with that uncomfortable position or being in pain from the position. And it's also going to help us increase compliance with being able to hold still and get through the exam. It really comes down to the classic, oh, wow, 10 minutes, I can do anything for 10 minutes. And that's where we're really breaking the mold with MRIs. The scans that normally take 30 minutes, we're experiencing about scan time now with our new technology. And it really is a win-win. It really has changed the game for us here at South Park. I've witnessed it firsthand with patients even accusing me of not doing everything that they needed done because the scan was so fast. And then I reassured them that with the new software, not only did we get everything we've always done for them in previous exams, we've even done it better than we've ever done it. So that's going to make our radiologists happy, like Dr. Mahanty, as well as you providers that are on the line today. So again, I really appreciate my couple of minutes with you guys. I'm going to turn it over to Dr. Scott Mahanty.
Thanks, Stephen. Hey, everybody. So thanks for taking your time over this lunch break. So I'm sure some of you have had MRIs before, family members have had MRIs. I know that you have some medical training and kind of different levels of experience and understanding of how an MRI works. So I just wanted to go through kind of 3 things for you to take home and hopefully be able to tell your patients and kind of prepare them for the experience and what we think is a much better experience overall. This is just a little chart here showing the Recon, which I'll talk a little bit more about. But basically, if you look for all these different types of MRIs, we're talking shoulder, L-spine, C-spine, hip, wrist, we're looking at a 40 to 50% decrease in the actual scan time, which is pretty impressive. And as you'll see, some better image quality as well. So from kind of the radiology side of things and the physics, MR physics side of things, we have a diagnostic dilemma when we try to improve the quality of an MRI image and also deal with kind of real world scan times and what a patient can tolerate. So really there's this inherent trade-off between a scan time, which as it gets longer, you will actually improve your signal to noise ratio and your resolution. However, if we're doing it for and this is going to lead to callbacks and rescans. And this also happens when you actually increase the length of the scan. We'll also talk about the 3T MRI technology. So I know a lot of you have heard about 1.5 Tesla and a 3 Tesla. And we'll talk a little bit about that. And then again, we'll talk about this Recon DL, which I'm sure you've heard of artificial intelligence, machine learning, deep learning, to give you the kind of the textbook definition of what deep learning is. It's a subset of machine learning that uses convolutional neural networks. And really what it's doing is it's taking some MR imaging data and reconstructing it to provide higher signal to noise ratio and improved sharpness or resolution. So again, improved image quality, decreased background noise, improved scan times, and also there's just new coils we have as well. So let's take a look at some examples here. So here's the classic 1.5 Tesla versus 3 Tesla. So here at South Park, we have a 3 Tesla magnet, which is, as a radiologist, is wonderful. On the left on this image, this is a 1.5 Tesla image. And then on the right here, this is a 3 Tesla. And you can see just the graininess overall from the left to the right. It's improved on the right. And actually looking at cartilage, since I'm an MSK guy, you can actually see that the cartilage is much better seen, and you can see small defects. So you can actually imagine this tiny little defect in the patella here is actually causing a lot of pain probably in this patient. So 3 Tesla, what is it good for? It's really good for brain vascular imaging and musculoskeletal imaging. The issue we have with 3 Tesla is classically they're actually slightly longer scan times compared to 1.5. And you can also get slightly worse artifacts, and that has to do with the strength of the magnet. All right, so now we have this 3 Tesla magnet here, and on top of this, we're using a deep learning algorithm called Recon that is improving the resolution. So here's some examples from the textbook. Here on the left, you're seeing a conventional reconstruction that has kind of ill-defined abnormality within the cervical spinal cord. See these lesions a little bit better, as well as the cord signal, as well as the bone in the background. This one may be a little bit more subtle, but you see a conventional image acquisition. And then with the Recon, you can actually see the trabecular network and the cartilage surface better. So again, another great example, sharper images with Recon. Here's the conventional image, and here's the reconstruction, and you can actually see this trabecular networks within the first metatarsal much better. Another example here, and this is a great one. So image A, this is a conventional image acquisition. So this is, let's say, an image acquisition in a patient that moved a little bit, and you can actually see how it's grainy. You've got a little bit of motion, and this arrow is actually pointing out the axillary recess where there's quite a few important structures. I cannot even tell what's going on here. I'm using the same data and using the Recon, you can actually make out all these structures. You can see the sharpness here. Another kind of more subtle, useful, I guess, component of this is some of these images are acquired in 3D. So this is one image acquisition, but then we can take that same image set and then reconstruct it in any plane we want. So that means we're actually acquiring less sequences and again, decreasing scan time. Another great example. So this actually flips. So here's the Recon. And then you can see on the right, this is a conventional image. That same right hip MRI, this labral tear here was not seen on the conventional image. Some actual statistics here from South Park. Overall, you can see we're looking a lot faster. So here's a knee MRI and the traditional sequences we're going to acquire. This is average scan time for each sequence before instituting this deep learning algorithm, and this is after. So you can see for a knee, we're looking at 50% reduction. For a wrist, also very good. So again, as Stephen was saying, if you can handle anything for 10 minutes, hopefully this will be better for patients. Here's another great example. So here's a pediatric example. So this is a 3-year-old. So if you could imagine trying to keep a 3-year-old still in a small magnet. And the acquisition speeds are faster that you can barely see motion artifact. So normally I'd be reading through a lot of motion artifact on this. So this is a great example. It doesn't require sedation. And overall, we're looking at better coils here too. So this is our lead tech here. And actually, I can probably let Stephen talk about some of these coils because he's a little bit more experienced with it here. But traditional, so this is basically a blanket that we can wrap around the patient. As to traditionally, we would be looking at something like a cage almost, right?
Yeah, that's correct, Dr. Mahanty. The new coils we have here also, the image on the right here, I can't help but to chuckle to see myself like that. But the coil on the right we refer to as a blanket coil, and it is a new technology with coils from GE as well. The previous designs or conventional coil in this scenario would not be able to be wrapped so close to the patient because the coils would start to actually work against each other and we'd get very poor image quality in the areas where those coils were so close. But with image resolution, the closer to the subject you place your coil, the better the image quality you're going to have. So with that said, you can see how with the blanket coil, when you can basically just take it and wrap the part around and not have to worry about how the relationship between the different components within the camera are going to fight with each other. It gives us a wide array of opportunities to get the camera closer to the patient, which is going to give you better image quality, but also allow them to be in a more natural position as well. So again, saving them time on the table, making them more comfortable in the process, and improving image quality all at the same time, which prior to these technologies coming together was impossible to do in the world of MRI. So these coils right here have been a real game changer as well for us with our patients, satisfaction and improving image quality for Dr. Mahanty.
Yeah. I mean, I would say overall, when I speak with my colleagues, my musculoskeletal colleagues, my neuro colleagues, they really find the image quality amazing. And so, hopefully we'll be able to tell you a little bit more about and get a little bit more information from each image and each study that you require. And I guess a little anecdotal story, my mother, probably a year ago now, actually maybe just before COVID, had her first MRI. And so she had mentioned it to me and I called and kind of prepared her. And she's a very stoic Midwestern woman. So she doesn't complain that often. So she called me immediately afterwards and she definitely chewed me out for not telling her how bad the experience was. So I kind of know firsthand that it can be difficult for a lot of people, and hopefully this new setup we have here will be great for years to come.
Okay, great. Thank you so much, Dr. Mahanty and Stephen, for giving us this really informative presentation. So for everyone on the line, we are now here at the Q&A portion. So again, you can submit your questions using the chat box feature in the Zoom platform, or if you would like to ask your question live and talk directly to Dr. Mahanty and Stephen, simply click on the raise your hand button and we will unmute you. So we'll go ahead and give it another minute or so for people to go ahead and start entering those questions, and then we'll answer those for you.
Hey guys, this is Travis Roseboro. I'd like you to give me more information about where we can find this particular scan, and do we have any plans for the future about expanding it?
Yeah, hi, Travis. Since that first was recorded and put out there, we only had that technology on the one system here at our South Park office. Since then, we've actually expanded that technology to 2 other existing locations. That is our Carolinas Imaging Services in Ballantyne, as well as our Carolinas Imaging Services of Huntersville. Both of them locations have the 1.5 Tesla MRI system, but utilizing the Recon AI technology. So that's in effect right now, that we have 3 current locations using this technology, with plans before the end of 2022 to have that technology extended to 2 other locations. One being in the Denver area, around Charlotte, and the other would be an upgrade at our CIS Rock Hill office. So hopefully by the end of the year, we'll have 5 locations live with this technology.
Thank you. That's great.
Yeah, and I think it's really important overall for kind of our whole network. So we used to only have or only want our, our sports teams and sports images to come to South Park because we knew we had kind of the higher quality images here. And now we're really getting that quality across the entire enterprise. So.
Thank you, Doc.
All right, we'll give it another few minutes to see if any other questions come through.
Everybody's quiet. Since we have a couple more moments, is there any particular patient that wouldn't benefit from this particular versus the old way of doing it?
I'm trying to think. Yeah. Not so in the imaging that I read, which is musculoskeletal and spine. Not in particular, because I'm thinking of certain scenarios where you'd want to use a, like a lower field strength magnet. And a lot of the times that's in the case of hardware. So potentially in a patient that has a bunch of hardware in their spine, a 1.5 might give, in some cases, a little bit better image than going to the 3 Tesla, which is where we do use the DRL, but that's about the only scenario I can imagine that it could be better.
Yeah, and then most of the time, those people with all that hardware, they have a hard time laying flat for a long time. So it would probably be, the better of both worlds.
Yeah, that's like picking. It's picking like the least evil, basically. So those are difficult patients to begin with to image.
Yeah.
So.
And well, what we've seen in using the ARDL technology, the physics factors that really drive the image quality are the same image factors that help with metallic artifact reduction. So with a MARS technique, MARS, what makes ARDL really happy and drive that quality also helps to reduce that metallic artifact. So having this technology on 2 of our current 1.5 systems, I believe is really going to be able to help achieve better imaging for those patients with hardware, as well as limit scan time at the same time, so that we are addressing that physical pain of being able to lay there like you talked about, Travis.
Yeah, the best of both worlds. Thank you, guys. I know a lot of patients will be thankful for not having to suffer through a grueling process and can get it quick and be effective.
Absolutely. I see it clinically every day. I had a patient yesterday who had a scan here with us at South Park and had a previous scan about 4 months ago at one of our other locations. And at that time, they did not have ARDL. And, I told him, I said, hey, this one's going to be a lot faster than the one you had before. And when I went in to take the patient out of the magnet and get them, up and prepared to exit, they were like, are you serious? We're done? I was like, they were really astonished at how the difference was. So, it's one thing for me as a technologist doing it every day to appreciate how quick it is. But when a patient is, really taken aback by how fast it is, I think that's where the real win is, in the whole process, is when the patient feels it and sees it.
Yeah, it does. I was in the field and I had somebody say almost the same thing, that, hey, the new process is quick. And I was just like, you must have had the 3T. And they was like, yeah, we did. And I liked it. It wasn't as as grueling as I remember. So thank you guys for this technology and this talk, because I know while I'm in the field, a lot of providers, when I tell them half the time or close to half the time, their eyes go up and they go, yeah, definitely. So, one question. So if I'm a provider and I want my patient to get 3T, is there anything I need to do to make sure they get 3T?
Well, from what we're seeing, I mean, we do have a lot of providers requesting 3T for certain exams. And I've also even see on some of the referrals, they're requesting 3T for anatomical areas or even pathology or symptoms that don't necessarily require 3T, but they just want that benefit. So what we're seeing on their referrals is they're either in a special instructions or somewhere in that free text kind of capability of their referral process or handwriting the order, they put patient to be done on 3T at South Park. And that kind of cues our referral team that it should be scheduled at South Park. And if somehow it falls through that crack, the clinical team, when they're pulling orders and verifying exams for future dates, they would see it. And then we can cue that this needs to be done on a 3T and have it scheduled appropriately.
Would it also help if they said, hey, patient is claustrophobic or patient has hardware difficulty in laying down for long periods of time? Would that clarify and give us more direction too?
Yeah, for sure. I think the more information a provider can put on that document helps the clinical team tremendously. Just by saying you're claustrophobic may not land you necessarily, here at South Park. Another thing we didn't, we're really kind of focused on this ARDL and going fast technology, but these are considered open bore systems. So, they are the 70 centimeter bore. They are the larger bore type, for those claustrophobic patients, of which we have 3 currently in the fleet with 2 more coming by the end of the year. So yeah, putting that patient as claustrophobic will at least drive them hopefully to that 70 centimeter bore system to help with that anxiety.
Okay. I just want to make sure I'm giving the referral coordinators and the docs the right information so that they can get that patient exactly where they need and, not waste time and energy. But thanks.
Oh yeah, absolutely. That's a great point. That's a great point. Difficulty holding still, claustrophobic, implants are always huge to know about prior to, because some implants can't be done on the 3T. And we do have situations, unfortunately, where patients arrive here at South Park and they have an implant. And, in the classic cases, well, my doctor said it would be fine, or they told me I could have MRIs with this, and not understanding the difference in the 1.5 Tesla and the 3 Tesla and what that means from an MRI safety standpoint in regards to implants, either electronic or just metallic. So knowing that upfront or even engaging with our team to help sort out, this patient's completely safe and ready to go on a 1.5, but we can't do it here on the 3T.
Great point. Thank you. I'll definitely put that out in the field.
Thanks, Travis.
All right. Well, it looks like we're just coming up a few minutes before the top of the hour. So just wanted to take this opportunity to once again, thank you, Dr. Mahanty, and thank you, Stephen, for sharing this really informative information and, spreading the word on the new technology that we have, because really our overall goal is to better the patient experience and then expand our healthcare services out into the Charlotte metro community. So thank you again. And thank you to everyone who took the time to listen in on the line. This webinar was recorded and a copy of this will be distributed to you by email afterwards this late afternoon or by early tomorrow morning. So you will receive a copy of that. So thank you to everyone again who has participated, and I hope that you have a great rest of your day.
Thanks, everybody.
Bye-bye.